Greetings, I'm Dr. Kim Kyung-won of Online Surgery. Today, let's look at the surgical video and discuss about it. First, let's look at the panoramic image. 58-year-old female patient. Lower right, posterior area, implants are placed, but the one in the middle, there's a lot of bone resorption and it doesn't look very good. However, the patient is saying that she's not facing any major discomfort and her chief complaint is lower left posterior area. There's a lot of mobility and pain and she wanted to solve this. Looking at CT number 5, alveolar bone has been resorbed significantly. In number 6, it was missing. Number 7, it is tilted mesially, and there's a lot of alveolar bone loss. The patient was in great pain, and at initial visit, extraction was done. In the lower left posterior area, apart from number 6, which was already missing, number 5, number 7, which was tilted, and wisdom tooth was extracted. And in the case of this patient, she wanted surgery, and I planned for OneGuide surgery. Looking at CT, in number 5, in the extracted area, alveolar bone on the buccal side, there's a lot of resorption. Number 6 was already missing. Number 7 was tilted. In that area, 2 implants were planned. Distance was going to be made between number 5 and 6, and in the area with resorbed alveolar bone, GBR was planned. As you can see in number 5, buccal plate is resorbed significantly. It's like this. The mental foramen is here. I contacted OneGuide team to design the OneGuide. In number 5, mental foramen is coming up like this. 4.5 in diameter and 8.5 in length. Implant was planned. And for number 6, there was distance with the inferior alveolar nerve. So OneGuide team and we decided to place TS3 5.0 by 10 millimeter implant, but the patient was female, and considering the amount of mouth opening, I thought maybe we need to change to 8.5, even for the distal implant. Considering the patient's level of mouth opening during surgery, I placed a 5.0 by 8.5 implant. The alveolar bone, the bone density itself is approximately D2. In the case of 35, TS3 4.5 by 8.5 was planned. For drilling, after initial drilling, diameter 3.5 and 4.5 were planned for implant placement. In the case of 36, diameter 5.0, as mentioned before on OneGuide, actually 10 millimeter is possible, but considering the patient's level of mouth opening, I decided on 8.5. After initial drilling, diameter 3.5 and 5.0 drilling was done for implant placement. As shown, 2 implants will be placed in number 5 and number 6 for occlusion with the antagonistic teeth, and in the area with alveolar bone missing, bovine bone is going to be used for bone graft. Post-op panoramic image, 2 implants have been placed. As mentioned earlier, in the case of number 35, a 4.5 by 8.5 implant was placed, as was originally planned. Distal to that, there was distance with the inferior alveolar nerve, so the plan was 10 millimeter, but considering the level of mouth opening, 5.0 by 8.5 millimeter implant was placed and GBR was done on top. Bone graft was done. As shown, mental foramen is here. 4.5 by 8.5 implant was placed, and distal to that, 5.0 by 8.5 implant was placed. On top of that, bone graft was done. In order to prevent alveolar bone resorption, bovine bone was used. A xenograft was used for GBR. Post-op CT shows that the implants were placed accordingly with our original plan and successful surgery was done. Let's look at the surgical video.
장치 한번 다시 껴서 맞춰보고
OneGuide template was checked once again whether it fit well. Of course, I also did it before surgery. There was insufficient attached gingiva and GBR was planned. Although OneGuide will be used, incision was made and surgery was proceeded with slightly reflected flap. Say ah.
너무 쳐들지 마시고요. 살짝 하셔도 돼요. 편안하게.
Say ah.
네, 편안하게.
Just be at ease.
한 번만
Say ah.
그쵸?
Say ah. Wider.
네.
아.
Say ah.
네.
뒤에서 조금 힘들어요.
아.
Say ah.
조금만 하고 이제 심으면 끝나요.
We're almost there. As mentioned earlier, considering the patient's level of mouth opening, I decided to place 8.5 implant. Say ah wider.
네, 다 심었어요.
Now implants have been placed.
무슨 일이야?
56.
고쳐서 생각하기 좋은 건
On the bone defect in the back bovine bone, AOS was used for bone graft. Collagen membrane OneGuide was used to cover here. One more layer was used, so a total of 2 layers of OneGuide was used. GBR was done only on top, so even without periosteal releasing incision, flap can be closed nicely. In this case, I wanted to tell you that even if you use OneGuide, you don't just blindly do flapless surgery. If GBR is necessary, make incision and place the implant using OneGuide, connect cover screw, and on top you can use bovine bone for simple GBR. 2 layers of collagen membrane were used and suture was done. Thank you for watching.
시청해주셔서 감사합니다.